Thank you for tuning in today. My name is Dr. Carrera, and this is our Ask Me Anything session, and I'll be answering questions pertaining to eyes and vision and pregnancy. So we have a list of questions here. I'll go ahead and get started. First question says, I'm 6 months pregnant and my vision has been a little blurry. Is this normal? So it's actually not uncommon to have vision changes during pregnancy. This can occur for many reasons, most of which are physiologic or normal and expected. And thankfully, after pregnancy and breastfeeding, those vision changes can return back to pre-pregnancy levels in most cases. What actually is occurring is, as many of you well know, there's a lot of fluid retention and hormonal changes during pregnancy. That actually can cause, I have a model here, actually can cause swelling in the cornea. So the window on the front of the eye here, and it can actually change the shape of it as well to make it more steeper. Well, this changes your prescription. This is part of the optical system. The eye works like a camera. And when the shape of that changes and the thickness of it, it basically makes the lenses in your glasses or contacts different, or what you need different. So those changes can cause vision changes and blurry vision. It can also affect the lacrimal gland. The lacrimal gland is the glands around the brow, and they create basic lubrication for the ocular surface with the tears, and they can cause dry eye. And when the surface of the eye is dry, it's like a windshield that doesn't have windshield wiper fluid. So it temporarily can fluctuate between blinks. One blink can clear and one can smear with the vision. So that can also contribute to blurry vision, both of which of those should improve following pregnancy. The second question says, I started experiencing blurry vision and was diagnosed with gestational diabetes. Is this common, or is it related to something else that should get checked out? So first of all, congratulations. As far as diabetes is concerned, if you did not have pre-existing diabetes, and this is the first time you've been told that you had diabetes, gestational, actual recommendations right now are that you don't need any eye exam or screening exam as long as you're asymptomatic during your pregnancy, and studies have shown you're not at any increased risk for developing diabetic retinopathy. However, if you had pre-existing diabetes, type 1 or type 2, the recommendations are to have a screening exam before conception if you're planning, and then also early into the first trimester. And then you may require follow-up examinations depending on what is found during that initial examination. Specifically pertaining to you though, if you're having vision changes, your vision is blurry, this could potentially be some of those changes that we would expect with pregnancy, and it's simply that. But it's hard to say. Just blurry vision, lots of things can cause blurry vision. So if you are having blurry vision, it may be worth calling your eye care provider for an exam to get checked out. Let's see, number 3. I don't usually get vision exams, but I just found out I'm pregnant. Should I get checked out more often? First of all, also congratulations. Congratulations to everyone that sent in questions that's recently been told they're pregnant. Actually, you don't. The current recommendations for just pregnancy alone without any symptoms, that you don't need a screening exam or more exams during the pregnancy. However, if you're developing any blurry vision, vision changes, things like that, certainly be worth getting checked out. This question here says, what causes blurry vision during pregnancy? That's a great question. Probably should address that earlier on. We've already talked about some of the physiologic or the normal changes of pregnancy. And it's just dealing with the fluid shifts and hormonal changes and things that return to normal following. There are other things that can cause blurry vision during pregnancy, one of which would be specific diseases related to pregnancy, things like preeclampsia or eclampsia. Those can certainly affect the vision. Other things can be modifications of existing disease, such as diabetes or uveitis or inflammatory conditions of the eye. So there's lots of things that can cause blurry vision. The main thing is to make sure that you have an eye care provider, you're communicating with them. If you're having any changes, certainly just call and set up an appointment to be seen and ensure that everything looks normal and proceeding as normal. It doesn't need any more intervention. I have a patient here. Let's see. I'm having headaches along with blurred vision, and I'm 3 months pregnant. Is this something I should worry about? So, typically, normal vision changes that occur during pregnancy are painless in most senses, and despite popular misconception, headaches a lot of times aren't caused by blurry vision. It's uncommon for headaches to come from blurry vision. It can happen, but it's uncommon. There are some conditions of pregnancy that are tied to blurry vision and headaches. Preeclampsia would be one of those. So if you're having those symptoms, I would highly recommend following with your primary care provider and your obstetrician, making sure your blood work looks normal and urinalysis and all that, and everything's within normal range. Also check blood pressure. If you're having persistent blurry vision, I would also recommend calling your eye doctor, making sure that there's nothing underlying that is going on that causes these symptoms that you're having. Let's see, I am in my first trimester of my first pregnancy, and I have a lot of morning sickness, followed by blurred vision and dizziness. Is this normal? Frequent morning sickness or vomiting, of course, you're losing a lot of fluids. It can lead to dizziness and dehydration, which can also cause blurry vision. That would be temporary. So that certainly could be related. First thing I would recommend is staying hydrated, getting your daily recommended intake of fluids. I would also discuss this with your obstetrician to make sure there's no medications that can be used to help with the morning sickness, and see if this helps with the blurred vision and other symptoms you're having. If the blurred vision is temporary, just following times of illness, that would be my initial recommendations. If you're having persistent or worsening blurry vision, please call your eye care provider. I feel like a broken record at this point, but call your eye care provider. There's lots of things that can cause blurry vision, everything from normal to problematic. So I'd recommend getting checked out if you're having persistent blurry vision. Are there any medications to take to help with blurred vision that are safe to take while pregnant? So as you already know, there are multiple causes of blurry vision. Most of the common causes are normal pregnancy related changes, and most of those are just observed. Typically the vision changes are mild, and they return to normal, so there's no medication really to use there for the swelling in the cornea, things we mentioned there. However, if you are having blurry vision due to the dry eyes, and your eyes have the sensation of dryness, such as burning, scratchiness, excessive tearing, foreign body sensation, irritation, you can try over-the-counter artificial tears. Any brand works, and some work better for others, but it'd be worth trying a couple of times a day and see if that helps improve the symptoms. If you're having persistent blurry vision, certainly worth being checked out. Is it normal for my eyeglasses prescription to change while pregnant? Yes, and in most cases, it's not recommended to get a new glasses prescription or a contact lens prescription unless you know that you plan on it being temporary and this is just to get you through pregnancy. But if you're wanting a new fancy glasses, I would actually recommend holding off until after pregnancy and breastfeeding so that things are stabilized. You're not chasing your tail, because that you won't get a long time out of those glasses or contacts if you get those during pregnancy. Let's see. This says, should I wait to get LASIK until I'm done having children? This is a great question. So not necessarily. You shouldn't. I don't think that I would recommend, if you want the improved vision that comes with LASIK, not necessarily worth waiting until your mid to late 30s before you approach that. Just know that my recommendation, most surgeons would recommend not having LASIK while pregnant, because when you're doing the LASIK, it's in the same area as the swelling occurs. So it's on the cornea, on the window on the front of the eye. We're using laser to basically resculpt the cornea and build in your glasses or contact lens prescription into that. Well, if this is swollen and irregularly shaped because of pregnancy, and we put your glasses prescription on that to get you clear after pregnancy, we're chasing our tails a little bit. So I'd wait at least 3 to 6 months until after pregnancy and breastfeeding, so things are returned to normal, and then you can proceed at that point with evaluation and planning for surgery. Just knowing that in the future, subsequent children, that pregnancy may change your adjustment. So it's generally temporary, but vision could potentially get blurry even despite having LASIK with subsequent children. Let's see, last question. Actually, this works out. I had a patient, I had LASIK done 5 years ago, and when my husband and I thought we were done having kids, we just found out we're pregnant with a surprise baby. I've heard that pregnancy can cause vision changes. What should I look for signs that my vision is changing, even though I've had LASIK? So yeah, this is a patient that has had LASIK, and they're wanting to make sure that nothing's changing. So congratulations on this surprise there. As we've mentioned multiple times, there's lots of things that can cause blurry vision, and the types of symptoms that you can have can be wide as well, a huge variety, everything from blurry vision to flashes, new blind spots, or blurry areas, a distortion of vision, double vision, all sorts of things with the eyes. So any of those changes, certainly call or reach out to your eye care provider for an eye exam, making sure that nothing's changing. Most of the time, the vision will go back to baseline of what it was before the child, and you'll be able to continue to enjoy the benefits of your previous LASIK. There are rare occasions where some of those changes persist, and you may need an enhancement. I would recommend working with your eye care provider and doing what's necessary and what you guys agree on. So it looks like that would be the end of the questions. I want to thank everyone for joining me today and sending in your questions. I hope that I was able to address everything and answer all those questions. If you have any additional questions, feel free to reach out to us. I'll be happy to address those. I hope everyone has a wonderful day, and keep an eye out for our next AMA session, where we'll be here at your disposal, answering your questions and helping you have the best vision.